Welcome to the Lead Change podcast. I'm your host, Dr. Mary Mulcahey. I'm an orthopedic sports medicine surgeon with a huge interest in contributing to the growth and development of other leaders. On this podcast, we will share stories from many leaders in all medical specialties to understand the skills necessary to be an effective leader. We'll celebrate their success and hear about strategies to overcome hurdles. We will also highlight some of the unique challenges faced by women in medicine who are interested in pursuing leadership positions and the importance of mentorship, sponsorship, and allyship in achieving and being successful in those roles. Let's work together, build on shared experiences, learn from those before us, and use these lessons to propel us forward in our career. Let's lead change. Welcome, everyone, to the Lead Change podcast. I am so excited to have Dr. Ellen Casey as our guest today. Dr. Casey is an attending physiatrist in the Department of Physiatry and the Women's Sports Medicine Center at the Hospital for Special Surgery in New York. She is also a professor of rehabilitation medicine at the Weill Cornell Medical College. After earning her medical degree from the University of Virginia School of Medicine, she completed residency in physical medicine and rehabilitation and a fellowship in sports medicine at the Rehabilitation Institute of Chicago, where she also actually served as chief resident. She was co-director of the women's sports program at RIC from 2010 to 2014 and the co-director for the Penn Center for the Female Athlete from 2016 to 2017. As a former collegiate gymnast, Dr. Casey is really passionate about caring for all athletes, particularly gymnasts and dancers, and she has served as USA Gymnastics women's national team physician since 2019. Dr. Casey's research focuses on sex and gender disparity in musculoskeletal injury, including the role of the menstrual cycle and hormonal contraceptives on ligament and tendon injuries, as well as injury risk reduction strategies in women's gymnastics. Ellen and I met over 10 years ago when we were both faculty at Drexel in Philadelphia. We both had a huge passion and interest in women's sports medicine. We have worked together on several research projects, and while at Drexel, we actually coordinated a half-day women's sports medicine seminar. It has been phenomenal to watch Ellen's career grow, and I am so excited about discussing her leadership journey on the podcast today. Ellen, welcome to the podcast.
Oh, thank you so much. It's such a pleasure to be here and catch up with you and kind of talk about, where our careers have taken us since we met so long ago.
Yeah, it's awesome to connect in this way. So before we dive into some more details and specifics about leadership, I was wondering if you can share with everyone a little bit about your clinical practice, touching specifically too on some of your other areas of expertise and interest.
Sure. As a physiatrist and sports medicine physician, I kind of see a combination of spine disorders as well as peripheral joint soft tissue injuries. In my practice in New York, I can see people from ages 7 to 99 or so in a day. So it's a wide range of patients, which is fun. Some people coming in with acute injuries, some people with chronic issues that have flared up. We have fellows in clinic with us all the time. So teaching about, what's a spine issue, or is it a shoulder or a hip, and where this pain is coming from, and kind of connecting the dots in the kinetic chain is always a really fun challenge. I do injections with ultrasound and fluoro guidance. And then I'm 50% research and clinical. So, when I'm not seeing patients, I'm trying to not only build my own research, but as I have a role in sort of developing research for our department, really figuring out how to grow research within our group and really create work within our institution and kind of beyond that.
That's awesome. So many different hats that you're wearing even in your clinical practice. And as part of that, you touched on it a little bit, and we did in the intro, but you work at the Women's Sports Medicine Center at HSS. And so the Women's Sports Medicine Center and this women's sports program is probably the oldest and most well-established women's sports medicine program in the country. So can you share with everyone, when and how that was created, and what are really some of the important components of that program?
Absolutely. So the visionaries for this center were Dr. Lisa Callahan and Dr. Joe Hannafin, and they came together with a shared passion, much like we have, in caring for comprehensively the female athlete or exercising women. And so they pulled in multiple disciplines, and we still have an interdisciplinary group. So we've got sports medicine physicians, non-operative physicians. We have from primary care sports and physiatry. We have sports dietitians. We have physical therapists, exercise physiologists, sports psychology, It's such a robust group. And while we're not all in the same physical space, all the time, we're really connected in treating our patients. And so you may have a lot of conversation about somebody, let's say, that's coming in with a stress fracture, and we're thinking about what's their nutrition status, their menstrual health history, REDS or the triad. Do they need to see someone else, or can we manage this in someone's clinic? And that's really the fun part, because I get to learn from everybody else that's treating a patient together. The patient gets to have all of us be connected. And, so it's great for the patient, but also really great for those of us working together.
Yeah, and that's fantastic. And that program really has set the precedent and serves as a model for many other programs around the country that have been developed, including what we've developed at Loyola. I mean, I have learned a lot from Joe Hannafin and others, and, program at Brigham and just others that have evolved, but it really started at HSS. And so it's fantastic, I'm sure, for you to be part of that, certainly for all of us around the country to have learned and continue to learn from what you guys have created there. And, you have held several very important leadership roles, and I'm going to touch on some of these through basically some different positions you've had throughout your career to kind of see how you've evolved and what you've learned as part of these positions. So you were a gymnast at Penn State, and you served as a team captain while you were there. So what was your experience like, first being a collegiate gymnast, and what important skills did you learn as being captain of the team?
Yeah, it was such a great ending to a career to have the opportunity to compete in college. As many people know, gymnasts start their careers usually really young, and college is sort of like the icing on the cake for a lot of training. It's a very individual sport until you get to college, then it becomes a team sport. And that's sort of some of the leadership I think that I picked up on in watching captains prior and our coaches navigate a bunch of individual athletes or people coming in together and then having a common goal. And, there's effective ways to, I think, get people to work together, and some not so effective. What I found with I was a tri-captain, so my two other co-captains and I, we really wanted to focus on everybody's individual skill sets and needs, moving towards a shared vision. There was other teams I think that I'd been on where the idea was we all do everything the exact same way. You do your mental training the same way, we do the same number of routines, and that's going to bring us all together. But we really found that if we honored people's individual needs and desires and what made them feel great and prepared, we actually got a lot further, and it felt really good to everyone to, kind of approach it that way.
Yeah, that's such a good point, is that you really want to focus on the individual, right? And you're bringing out and supporting their strengths. And I'm sure you guys as captains saw the benefits and a positive that the athletes themselves felt the benefit of you really supporting them as individual athletes. So really great to, I'm sure, like watch them grow and evolve too with that kind of support from you guys.
Yeah, absolutely. And I think that transitions to training, people within residency and fellowship. Not all fellows are going to learn the same way. Not all of us learn the same way. And so when you can kind of have some conversation about what works for you, you still need to, of course, get the skill set, but, there's different ways to tackle that. And so I've definitely drawn on the sports experience and kind of bringing that into leadership in medicine.
Yeah, it's important, and it's great that you as faculty in that program that you're really like working to their individual strengths and needs to help them learn the material that they need to learn, that they want to learn, and to help them be successful independent physicians. I would definitely want to touch on some other roles that you've held, but before we do that, I wonder if you can share with all of us too, what is the main driving force and motivation for you?
That's a hard one. I mean, partly I feel so blessed that I just academically love, medicine, understanding human movement and performance. That's what really kind of drew me into sports medicine. So I still find the learning of medicine so fascinating, or learning a new skill or technique. So I love that we get to be lifelong learners. But honestly, I think it's each patient encounter, you have an opportunity to get a sense of what does a person need. And you may not have that exact answer or resource, but, getting them a little bit further or closer to what they're looking for, solving a problem, but giving them tools so they can solve it themselves in the future. I think it's really working with people to hopefully get them further along functionally, make their lives a little bit better. And that's not always easy, but I think that individual one-on-one encounter with patients is still so exciting to me.
Yeah, it's really special. It's a very unique opportunity. And in fact, I think all of us consider it a privilege for what we do, the interactions we have with patients, the relationships that we develop with them. But I think also you touched on a really important point in that we are constantly learning, right? And so what you're doing now, what we're all doing is quite different from what you did when you finished residency and fellowship, but that we are building on those skills. And so it's great that you're very passionate about that. You're always seeking out new opportunities to learn, build, grow your skills, and offer these opportunities and these treatment options to your patients. We mentioned a little bit in the introduction, but you were selected to be chief resident in your PM&R residency program at Northwestern. So huge congratulations. That is not an easy thing. So for those listening who might not be familiar, can you explain how you were selected for that role and what was involved? What were some of your responsibilities?
Sure. So prior to my year as chief resident, the way the structure was is 2 residents a year would get selected, and one would be the chief for the first 6 months and one would be the chief for the second 6 months. And the selection process was a vote from the fellow residents. We had 40 residents in our program, as well as the attending physicians. So, people who thought these people would do a good job, you get the most votes, and then you're asked if you want to do it. But what I noticed and my, classmates noticed is when you were chief for those 6 months, it seemed like your education suffered, your ability to sort of, look for fellowships, all of that it was so encompassing. It's a large residency program. And so to have that sole responsibility for 6 months really took a toll on what seemed like your education, which, residency is short, and we wanted to maximize that. So we got together and proposed a shift in the system. Instead of 2 chiefs each doing 6 months, we proposed a 3-chief system where the first person was kind of like the scheduler, making a ton of the spreadsheets and figuring out all the logistics. So kind of an operations person. The next one was chief of education. So they'd handle grand rounds, all the resident lectures, and navigating that. And then the third essentially is like an ombuds person, where they're we called it resident affairs. So essentially any of the concerns, complaints. Our program director had been doing this for years and years, and he's a wonderful leader. I had noticed about him because I'd been on his service is you don't present an idea and expect an answer right away. So we decided he probably needed like 3 discussions about this before we would ask if this could really be possible. So we kind of floated the idea, revisited it, and then, ultimately everybody liked it. And I actually love to say that they still have that same 3-chief system so many years later. So it's pretty cool.
That was going to be my next question. Is it still in place? That is so awesome. Good for you guys for thinking about it, thinking about how to make the system better, like proposing an idea and then actually affecting change. So that's incredible. And I'm sure, what was a little bit related to that? What was your experience? Like, number one, just serving in that role. What was the experience with that new 3-chief system? And what for you were some of the main skills that you took away from that year?
Yes. So it was funny that the 3 people that got selected, we had very clear, like I was obviously going to be the scheduler because I love a spreadsheet. I love a list. I can, figure all the stuff out. And I know we have that in common. And when I was thinking of the schedule, I would like wake up in the middle of the night and be like, what, if we put someone there, then this will work. It was like a very encompassing, but then it was, done. And then we just had to tweak it. So I feel like I had that organizational skill set going in, but what I think needed to be prepared for and learned was it's not right or perfect the first time, and taking feedback and tweaking and new iterations of, the idea didn't mean it was a failure, that it wasn't going to work, but you had to do some tweaks because it was new. We also had a lot of explaining and sort of refreshing the attendings' understanding of what we did because this was a new system. So you'd have to say, you know what? Okay, great. That's the education chief. That's this person, or we're going to, go to this person. So you wouldn't just not, handle the question, sort of, re-educate people every time this came up. And, again, they're still doing it. So I'm sure they understand all the different roles now. Was, change is hard, right? People like it to be the same. And so I think if you, can experience a change where you just consistently stay with it and people accept it, that's a huge accomplishment.
Yeah, it's very impressive. And I love that, like a little re-education, reorienting of the faculty. But faculty, we know now we're faculty. We're like, you tend to be sort of like rigid. You're like, well, these things are this way. And so some things it's nice to have similarity. And then in other ways, we're constantly evolving in our practice and whatnot. Yeah. But it seems like they really appreciate the system now. Have there been any pivotal points in your career that have been particularly important to getting you where you are now?
Yes, I think that I trained in Chicago. I stayed at RIC for 4 years as an attending, and if it were all things being equal, I would have thought I was going to stay there for my whole career. But my husband's from Philadelphia. He really missed being back on the East Coast and close to family, and we went to Penn State, so a lot of our friends were there. So making that move for personal reasons, we just had two kids. It seemed like a good time, was important to us personally. Professionally, it was a huge change to go to Drexel where there were no other physiatrists, to come from a place like REC where, huge program, then go there. But I do think being forced to sort of figure that out without the comfort of, this place that you trained and learn new pathways, make relationships, that really was important. And actually changing a couple different other times because of new opportunities, so is really required feeling confident in being able to build something no matter where I go. And now I can tell fellows, hey, for me it takes about 2 to 3 years to kind of figure the system out, get your practice running the way you want. And having done that a couple times, it's actually, I think, been a great challenge. Not one that I initially thought I wanted, but very cool. And I don't know that I would have ended up at HSS, which has been fantastic, without that, navigating that road.
Yeah, and I think you talked about how you have this discussion with fellows too, but it's great that you can help them understand, like, don't be afraid of change,
Yeah.
right? Be willing to consider opportunities, and you see where you are now from where you started, and that each step was kind of a growing, like you built on it, and that you wouldn't be at HSS without being at Penn or Drexel or, all the training and the time you had in Chicago, which actually I forgot about that too. So it's amazing to be reminded of that. But I think it's a really, really important lesson for everyone listening to take away that, in medicine, it's actually quite common, especially in academic medicine, for there to be changes and to not be afraid of it, and to certainly, like, when there's a great opportunity that is presented to you, like you had with going to HSS, to jump at that.
Yeah, and I think being nimble, the great thing about HSS is there's a lot of people that have been there their whole careers. And in our department, what's fun is that more of us lately have been coming from other places, and you get to sort of experience, like, I know you've always done it this way, but hey, there's another perspective. And I do feel like having to have tried different places and pulling different things that you like from this place and that, and building connections, right, has been really enriched my career more than I thought it would.
Yeah, the network is incredible. And then you learn something from every place and you bring that with you. And so I think that's huge for HSS and huge for your department, for you to bring that experience and that perspective and share it with the other faculty and the residents, and like helping to train the fellows and the stuff that you do with the research. So everybody has benefited from the experience you've had. With all that, taking all these things together, can you describe your leadership style, and in what ways do you find that to be particularly effective?
What I try to do in terms of style is be very mission driven. So, kind of what are we trying to accomplish? What's the why, and how are we going to get there? I think for me, it's frustrating to have people in leadership positions that aren't maybe in the day to day and kind of experiencing how this can work. I know that isn't always possible, but involve yourself, get your hands dirty, be part of the change. And then I think, teamwork and team-based collaboration is the most fun for me. I love team science. I liked being on sports teams. Physiatry is a very team-oriented field. So that always appeals to me, kind of like what I was talking about in, gymnastics, where if we all bring our individual strengths, then, we are stronger, richer of a group and able to accomplish what we're trying to do.
Yeah, and that's fantastic, right? You tie it back to collegiate athletics, but that whole idea, having a mission, having a goal, understanding your why, right? What is the purpose of what you're doing or what the group wants to accomplish? And it sounds like, from what you're saying too, that when everybody understands that, then there's sort of mutual buy-in and a feeling like everybody is involved in achieving that goal.
Right. Right.
And then hence it makes it so much more likely that you guys will all achieve that together. So I think that's a really important point to take away. And we were alluding to this just a minute ago, but I did want to touch more on the role that you currently hold as Director of Research for HSS Physiatry. So when did you start in that role, and what are some of your responsibilities?
So I started when I joined HSS, which was in 2017. And a little bit of kind of context, our chair of our department, Dr. Joel Press, is one of my longtime mentors. So he had really fostered my research career from sort of the beginning. When I was hired, even though I hadn't had external funding, he was supportive of me getting into a kind of training program, and I got a K-12. And he, even though that wasn't normal for our department, we had all clinicians, he was happy to adjust my schedule and allow for me to really focus on research. So what he was hoping when I came to HSS is that we'd really build our research infrastructure and productivity. So we have a lot of great clinicians who have research interests. But most people are primarily clinicians, and my role is really to figure out like what are the barriers, what are the pitfalls, why are things taking longer than we'd like, and essentially, using all of my resources and time to advocate to, get people what they need. So whether that's research assistance or statistics help or partnering with people across HSS or beyond, we spend a lot of time trying to figure out how to streamline processes so that people can be productive in the things that they're passionate in. But of course, clinical care, always kind of takes priority. So we really try to build up all the resources to allow people to research the questions that they're interested in.
Yeah, that's fantastic because it's often just those barriers that can prevent people from pursuing the things they're interested in. And how, with all those responsibilities, how is your time divided between clinical work and the administrative kind of roles with being the director of research for physiatry?
Yes, so I see patients 50% of the time and then either do my own research work or work on sort of the department research the other 50% of the time. And then in addition, I do stuff with USA Women's Gymnastics. And so it feels somewhat like three jobs. I mean, as we all know,
It's definitely three jobs.
they can all be full time. So I think one of the things I've learned is really prioritizing, and being very strict about my calendar. And this is deep work or research for me. If I'm going to write, I need time together. It's hard for me to do that in like half-hour increments. So I focus a lot on trying to protect that time and then work with, our faculty who want to do research to try to find time that they can carve out as well.
And I love that you made that distinction about deep work or focused work.
Yeah.
And I don't know if this is where it comes from, Ellen, but this is just literally sitting on my desk.
I'm a huge Cal Newport fan.
So I am reading that book right now. I'm like probably about halfway through, but that is a fantastic book, Deep Work. For any of you guys that are interested in reading leadership books, and we'll kind of dive in a little bit later too. But it's really important, like exactly what you're saying, for things that require a time and attention. It's like you have to have the ability to focus.
Right, absolutely. And I know that a lot of us, like, you can get sucked into emails or the patient portal, right? Because patient care, like, they want answers, and that's important. And it's not that you don't want to give them that, but no one's going to keep your schedule or time for you. They will not protect it for you. So that is a skill that I've learned over time and keep needing to relearn, actually.
Yeah, I agree with that. You have to do it. You have to protect the time for yourself and the things that you're trying to accomplish and get done, because exactly everybody else is just trying to take your time. So very, very important point. We've talked a lot about these successes. I wonder if there's been a particular challenge that you've faced in your career, and how did you overcome that?
Honestly, it's kind of related to what we were just talking about. I think that for a long time, I was really looking for like the perfect system. The amount of productivity things I've looked into, David Allen, Get Things Done, obviously Cal Newport, we were just talking about. And I wanted the truth to be if I just found the perfect system, then all this stuff would get done. And I think with maturity and time, I've realized there isn't a perfect system. I don't love the phrase work-life balance because I think it's a juggling act and there is no balance. And, there's phases to your career and phases to your, parenthood, if that's what you're doing, or caregiving for other people. And I mean, that makes me uncomfortable because I want there to be a perfect system that if I just figure it out, it'll all be smooth sailing. So I think that is a constant struggle in sort of, there are ways to make it better, right? Like we were just talking about, but also just accepting the fact that this stuff doesn't have to happen overnight. And I think it's hard for certainly men and women, but for women in particular, I mean, there's just it feels sometimes like you train this long and then you have such a narrow window of time if you choose to have kids and to have this stuff happening in your career, and it's all wonderful, but it's really hard to do it in what feels like 1 to 2 decades. And I know that you don't have to, but the problem is, I mean, there's a lot of wonderful opportunities that you want to do. It doesn't even feel like a hardship. And sort of, I think the skill set of prioritizing those is hard. One of my mentors, and I tell him this all the time now, would say, just say yes to everything. And I think you can do that at times. But what I realized is I never learned, not, I'm comfortable saying no, but I didn't learn how to say, okay, well, if I do this, then I either have to table this or reduce this and kind of navigate the, what reality is. And I think I grossly underestimate how much time things are going to take. And, someday maybe I'll learn that.
I think we're all working on this constantly,
Yeah.
but I think you have definitely we learn more as we get further in our career. So I agree. I have had similar experiences, but I think it is really important at some point you need to realize when you take something else on, something else has to go.
Yes.
Your priorities and the things you're interested in change as you go through your
Right.
career. So I think one thing that I try to keep in mind is, what are our personal sort of mission, vision, and goals? What's
Mm.
important to you? And when you're presented with an opportunity, and I'm sure you do this, does this fit with what I'm trying to accomplish, and with the things I'm most interested in? That actually helps you a lot in making the decision.
It does. It does. I'd love a coach to do that with me because I think don't hold myself accountable, but that would be really helpful to have somebody that like even you'd literally go through those items. And you can do that in buckets, like research mentors can help you certainly with the research questions of what you should do and not do, but it's really like you got to have a way to do that across all of these different areas. And including your personal life.
Yeah, very good point. And it's helpful to kind of be able to bounce these ideas off of people and get their
Yeah.
insight and advice. Throughout your career, you have worked with numerous leaders within and outside of your institution. So, can you describe some of the lessons you've learned from leaders that you really admire, and what do you think makes them good leaders?
I think that the people that I have enjoyed working for and with the most and really strike me as good leaders are, you know who they are. They're authentic and honest. You get a sense of their character. I think there's a saying like, not what people say to you, but how they make you feel. And you can feel great leadership, maybe even without understanding what, pieces go into that. But I would say, I think too, just the idea of somebody who figures out, okay, what do we need to do? What are the barriers? And then really advocating for everybody to be able to navigate those. Those are the things I think stand out to me in terms of leadership.
Yeah, I love that. But two things like being authentic, like being true, being yourself, and that you can feel a good leader. I love that. I have actually never heard anybody say that, but I understand what you
Yeah.
mean by that. And I think that's so true. So I love that you said that. I wanted to touch on one other leadership role that you currently hold, which is serving as a team physician for USA Gymnastics. So you have also served as the medical lead for national championships and the Olympic trials. So I can imagine that is an absolutely tremendous experience. So, what are some of the most important leadership skills that you've developed by serving in that role?
Yes, those are certainly very exciting, often stressful just because of the enormity, right, of the pressures on these athletes. And I mean, but it's also an incredible privilege to be a part of the team behind, the team, if you will. So that's fantastic. I think what's interesting about the delivery of care at these types of events is, USA Gymnastics will say, we're having Olympic trials in Minneapolis. And then we have to, the medical group in the organization has to create this infrastructure for this 1 week or week and a half where you're plugged in with the local hospitals, obviously the EMS, physicians that, donate their time, athletic trainers, physical therapists, all of these different pieces. And it requires a lot of, thinking ahead, certainly the emergency action plan, but all the other pieces of care that our athletes, want and deserve. So it's a lot of planning up front and then really making connections with the people you're going to be working with while you're there. And sports medicine is all be prepared and hope to not be needed in many ways in terms of, we call it field of play, but sideline coverage. And for a while I struggled a little bit with, if I'm needed generally in the the field of play in the competition, somebody's worst day or one of the worst days, right? That's heavy, and you want obviously to, treat them with excellent knowledge, but, care and compassion. And all of those things are a privilege. But usually if I'm required to do something, it's not a great day for them. But it's also a privilege to be with somebody in a really dark time.
Yeah, a really important point. Exactly. Like I agree with you completely. We do all this preparation, which from what you're explaining is a tremendous amount of work. Like I've never had that specific experience. So tremendous amount of work collaborating with a lot of different people, making sure everybody knows who's who, where you're supposed to be, what you're doing, and just preparing for the worst possible scenario,
Yeah.
right? So that you're ready, but we hope, of course, that the day goes perfectly. But I think the key is being prepared, is that everybody knows what they're supposed to do, how to do it, where to go.
Right.
And that makes all the difference, so that if and when something does happen, that the athletes can be treated appropriately and quickly. Um, I wonder too, is there anything specific that you have done to help develop your leadership skills? Meaning, like, have you participated in any specific leadership skills courses that you found helpful, or any other type of training program?
So formally, I did, I think when I was at Drexel, so about, 10 years ago or so, I went to an AAMC kind of early career course, which was really great. I mean, you learned a lot about what type of leader you are in terms of getting a sense of how you like to hear information, how that interacts with other people. The other thing that I've learned a ton from is Joel Kress, who I work with, has created this mentorship, kind of a 12 part program for our fellows. We have 4 fellows every year, and we divide it up. So it's usually an attending from our department and maybe one of our surgical colleagues from HSS, or we might pull somebody from another institution. And you kind of co lead your mini session. And so there's this outline that we've worked on to develop. There's reading materials, podcasts, things that go with it. The 2 sessions that I usually do, one is on mentorship and sponsorship, how to give it and how to find it. And then the other is leading with vulnerability. That's a new one that we added this year, which I really loved that discussion with the fellows. But honestly, I feel like, I've learned as much as they have. So while it, hasn't been a formal course, it changes every year, and what the fellows, kind of give to the discussions is different. So those have been really great for me too.
Yeah, that's fantastic and amazing. Like you learn by teaching, you learn from the fellows, you learn from the other faculty, but I also think it's amazing that you guys have incorporated it. You continue to incorporate this leadership program for your fellows, because I think that is in general an area that's lacking in medicine and medical school, residency, fellowship. There's not a lot of formal or dedicated leadership training. So great. Congratulations to you guys, and I'm sure your fellows love that. And very cool too that you incorporate a lot of different resources and media, including podcasts. Maybe this episode of Lead Change will make it into your curriculum. anything
All
that anything that can help the fellows learn. So that's really fantastic. You and I were touching on kind of informally on some of these leadership books, but are there any that you have found to be particularly impactful or influential for you?
Yes. So I think your podcast has mentioned before Simon Sinek's book, Start With Why. I love that. I also love Dare to Lead by Brene Brown. There's also, I listen to a ton of podcasts on my commute. So Adam Grant's podcast. In fact, the episode where he and Brene Brown talk about vulnerability and leadership is awesome. And quite frankly, I think Ted Lasso is a masterclass in
I
leadership
love
as well.
Ted Lasso. That's so great.
Yes, it's just fantastic. And so I actually had our fellows, if they hadn't seen it, which was shocking to me, I sent them a couple clips just because I think, it's just such a beautiful example of leadership in so many different ways. So yeah, I'm glad they're coming back for more.
Yeah, I know. Me too. There are so many important and valuable lessons to take away from that show. I think that's fantastic. You bring that up, and that you're also sharing that with your fellows. Like, fantastic. And that's life. Like, this is,
Yeah.
and through soccer. And so it's
Yeah.
so great. Um, Rounding out, a couple final questions for you, Ellen. This sometimes catches people off guard, but I wonder for you, what would you consider as your superpower? Meaning, like, what do you identify as one of your biggest strengths that really contributes to your success and sets you apart from other people?
Oof, I think that's hard, but I think I am willing to be vulnerable with colleagues, with trainees with patients sometimes when appropriate, in terms of, saying out loud, after the fellow and I see a patient saying, I was thinking wanted to hear this. This is the direction I went. After the end of it, maybe I would have done this differently next time. So we always spend a very quick in the beginning of clinic. What do we want to accomplish at the end? One thing we thought went great, one thing we wanted to do better. So I think that piece of it is just being willing to be authentic and vulnerable.
Yeah, and I'm sure they appreciate that. The students, residents, fellows too, learn from you in that sense too, and understand like we're humans, like where we go through these things, we have
Right.
responses with the patients, and we adjust. Sometimes we
Yep.
may think it's going to go one way, but then we can quickly adapt and adjust, and that's so important.
Yeah.
And as a final question for you, Ellen, do you have a particularly favorite quote?
Yes, I was thinking about one that would make sense here. I like this one, well, two actually, if that's okay.
Sure.
One is from Ruth Bader Ginsburg that says, "A meaningful life is one lived not just for oneself, but for one's community," which is, so beautiful, and I think it certainly can apply to medicine, but obviously anything that you're invested in to try to do things for others with something that you're passionate about. And the other, when I left Chicago, Joel gave me a paperweight that says, "If you're not the lead dog, the view never changes." And I actually kind of wasn't quite, I mean, I got it when he gave it to me, but I feel like it makes more sense like the further you get in your career, and not that you have to be the lead all the time, but if you're not willing to try to lead change, then the view may not change.
Yeah, that's awesome. Right, where you're the one, you're there, you're helping to affect change in with the research in the physiatry department, with the fellows and this leadership program you're developing, and just the educational content you're sharing. So you live this every day. So I love those quotes. That is fantastic. So Ellen, thank you so much for being on the podcast. It has been absolutely tremendous and wonderful to reconnect with you and have the opportunity to share with everyone some of the many valuable things that you've learned along your amazing leadership journey.
Well, thank you for having me. And it's been just an absolute pleasure to reconnect with you, but also just watch all of the wonderful leadership you are doing in your career. And thank you for putting this podcast together.
Thank you very much. I appreciate that.